Hello and welcome to Talk to Your Health. I'm your host, Dr. Derek De Silva. More than 20 million Americans suffer from nerve damage known as neuropathy. It usually affects the hands and feet, making it difficult to carry out everyday tasks, including simply walking. Now, a cutting-edge, non-invasive physical medicine therapy is proving very successful in treating neuropathy. Here to tell us how it works is Amit Gaglani, a specialist in orthopedic physical therapy and the owner of Accelerated Physical Therapy and Rehabilitation in Woodbridge and in Edison. Welcome to the program.
Thank you for having me on.
So you're a physical therapist.
That's right.
You're a
yes.
physical therapist that is doing this new modality. Let's start off with, what is neuropathy?
Sure. Neuropathy is a case where individuals have degenerative nerves, and especially affects their lower extremities. So their nerves essentially start to degenerate.
And do we know what causes it? I mean, there's probably many causes, but what are some of the primary principal causes of neuropathy?
Sure. Some of the primary causes that we end up seeing in our office is diabetic neuropathy or chemotherapy-induced neuropathy.
Mm-hmm. And how common, by the way, is diabetic neuropathy? Is that the most dominant form?
It affects about 20 million Americans, so it is very common. It is a dominant form, yes.
You know, I see this all the time in my practice. I mean, it is probably one of the most unbelievable things, and you try the supplements, the medications, as far as I'm concerned, have never worked. I've never seen results from it. And, you know, so people are lost. What do they do? Let's start off with some of the symptoms. What do people typically feel? What sensations do they have?
Sure. So the type of symptoms that they usually get is weakness in the arms and legs, numbness and tingling and pain. They get impaired sensation of the position, glove and stocking sensation, symptoms of autonomic damage.
All right, so there's all kinds of stuff, but a lot of times people will come in and say to me, you know, I have this tingling in my feet or I have this numbness in my feet. That's really the primary thing, is it not?
Yes, it can be, absolutely,
Yeah.
yes. They can get numbness, tingling, they could feel like they're walking on tacks or marbles. You know, it's very uncomfortable in their lower extremities. And it doesn't have to be just in their lower extremities. It could be in their hands and in the form of carpal tunnel as well.
Okay, so you have this new therapy, you have a new modality. What is the name of it?
MicroVas.
Okay. What is it? What does it do? And we have some video that we're going to bring up, and you can maybe just talk us through this video
Sure.
as we see it. So this is the machine.
Here is our MicroVas machine itself, yes.
And tell me about it.
Sure. So the machine has 4 leads on one side and 4 leads on another side. Here I am applying large emitter pads onto the lower extremities. You can see one on the anterior surface of the thigh, and then one's going to go on the posterior surface of the thigh.
Or the back part of the thigh, right?
That's right.
Okay.
And it's going to go all the way down to the toes. So essentially you're going to have these large pads that go all the way down to the toes. It's not uncomfortable at all. As you can see, the gentleman is very comfortable and very happy. He's asking me questions about
but you
it.
haven't turned the machine on yet.
No, I haven't turned the machine on yet. That's right.
But tell me so when you hook this up, again, you're still putting these pads on, what happens here?
So essentially it causes a deep muscle contraction. It causes a muscle contraction which will cause blood to flow back to the heart more, and thereby increasing the blood flow to the extremities. So you're having more blood going down to the toes. So somebody with, let's say, diabetic neuropathy will have symptoms of like that numbness, tingling, or pain or sharp pain down to their extremities. It's because their nerves are starting to degenerate. When the blood goes down there, it actually helps to heal those nerves.
So blood flow really is the key to most healing, right? Whether
Absolutely.
it be ligament damage or cartilage damage or anything like that, it all comes down to blood flow.
That is exactly correct.
Now, do you have anything else that you do? You do this, how long does that treatment take, by the way?
The machine itself takes 45 minutes, but our protocol, the way we set it up in our program, I should say, the Accelerated MicroVas program that we set up, includes other things than just the 45 minutes of the machine.
What are some of the other things? Do you have other types of physical therapy or things that you do at your facility?
So we've coupled, in order to make this program, we've coupled the traditional MicroVas system with traditional exercises, and actually not even traditional exercises, very specific exercises and very specific manual therapy techniques.
Now, we have some other video footage here of what's going on. What's happening here?
So yes, you'll see this individual on a trampoline balancing with us throwing a ball at him. So it's actually encouraging his balance and his gait. He sees what's going on. He has to catch the ball. So we're increasing the blood flow with the MicroVas machine, but then we're following up with unique and special therapies to help him improve his ability to walk and stand properly and basically get back to life.
You know, this is not easy to do.
No.
To be jumping up and down like that and to catch a ball while you're doing that, this is, I know that this is not easy.
This is not for everybody. So that's why it's very specific to the individual. That's why when we do an exam, we find out what are their weaknesses and what are their problems, and we tailor-made every single program to that individual.
Mm-hmm. So this is a therapy that goes on for how long, and when do you start to see results?
Excellent question. The therapy itself goes on for about 12 visits. Mm-hmm. You start to see results within a 2-week period of time. There was an individual that we call our MicroVas miracle guy. Okay. Now this individual, after 12 visits, he actually asked if he could stay on for longer because he had incredible results. This individual couldn't walk more than 1 park bench.
Wow.
By the end of the program, he was able to walk 6 park benches back and forth and was so happy with the program that he wanted actually more. His wife was happy. It was a tremendous psychological boost to the gentleman to be able to play with his kids, to be able to do things with his grandkids as well.
Now, is this something that is covered by insurance? Because that's always an issue when it comes to any kind of therapy or modality.
Yes, it is covered by insurances. Insurances do cover MicroVas and our MicroVas program.
Oh.
And we have hundreds of test cases that we've done with patients, and they've been covered.
What about long-term prognosis? Once you do the therapy, is it a reparative therapy? Does it need to continue? What's the outcome?
Excellent question, because we get that question a lot. It does help restore the blood flow, and the blood flow actually helps heal the tissues. But if an individual doesn't take care of their own diabetes, then they're going to have future problems. If they take care of their diabetes and they continue doing exercises, then there's a long-term benefit to this.
Taking care of, continue doing exercises. What exercises? Stuff that you've shown them?
Exactly. Exactly. We will show them and we will give them a home exercise program when they're done and tell them to continue with these specific exercises. And that will help them increase the benefits of what they've already seen.
Keep up the great work.
Yes.
Thank you very much for joining us, Mr. Gaglani.
Great. Thank you.
Alrighty, folks, there's lots more to come on 12 to Your Health after the break. How bad posture could be the sign of an issue with your nervous system. And later, the FDA unveils its new graphic cigarette warning labels. But do they go too far this time? I'll weigh in when I give you my second opinion. But first, your health tip of the week. Yogurt is the most familiar source of probiotics, or the good bacteria. But here are some other foods that are also great sources of probiotics.